Heather, thank you for joining me today on this video interview.
Good to see you, Pam.
I'd like to hear a bit about your best hopes for the training we are doing June 18th and 19th, Legacy of Hope. What are your hopes?
Okay, well, I guess my first hope would be what's often my own first hope when I go to a workshop, and that is that there are some good takeaways. Really hope that people will go away with some practical strategies in their pockets that they can use in their own work with their own clients.
Mhm. I think a lot of clinicians feel a bit anxious or activated when they have a client who is talking about suicide.
Sure. Of course, I think that's very natural. And I think it's one of the areas where I think solution-focused approach is particularly helpful. For one thing, the more that I practice in a solution-focused way, the easier it becomes for me to assume, even in a very difficult situation, that there is more to the story than the pain and trouble that we hear about first.
Hmm. So in our training, you'll be giving us some experience of shifting assumptions.
Exactly. I think that one of the ways in which solution focused practice is helpful in this area is to help us to balance the conversation differently. I think that traditionally conversations with people who are thinking or talking about suicide, uh, because they're in so much distress, they see that as their solution. Those conversations have been very, very focused on their reasons for dying and their ideas about that, and from the clinician side on doing a suicide risk assessment. And I think that incorporating a solution-focused approach allows us to shift at least part of the conversation toward hope and reasons for living, and assessing what are the things that can keep this person safe and that have kept them safe so far. And that makes a big difference. I think it makes a big difference in the validity of our opinions. And that's well established in the evidence now. It also, I think, makes a big difference in how helpful the conversation is for the client.